type of lesion call this? From bone, but how do we describe it? Focal. In an edentulous area, right? Okay. Anything look unusual here?
Ground claws.
Yeah, ground claws, orange, yellow, yeah. So here we have a very distinct pattern. Bone in general has a pattern to it. We see that. But this looks almost more uniform than even what bone normally looks like, right? Okay, what about this one? Yep.
The location would be periapical, right?
Yep. This one's unique because it has a scalloped margin. See that?
Is it a target lesion?
What?
Is it a target lesion?
Where are you seeing this?
Distal to the mandibular right molar. Oh, oh yeah, I got them mixed up. So it would be swapped for a target lesion because it's opaque with a ring. Okay. Okay. Written in my notes as radio opaque for both the unilocular and the
Okay, so
target lesion.
talk me through this.
So it's radiolucent in the middle and is surrounded by a halo of radio opacity.
Point. Let me see. I want you to point to it.
Okay. If I can. Everything to stay up. It's gonna fall, I just know it. Oh no. Stay.
Is it radiolucent or radio opaque?
The inside is radiolucent.
Okay.
Ring is so it wouldn't be a target, right?
But
It wouldn't be a target then, right? Because it's flipped for target vision. It's opaque in the middle and lucent around it.
the target is opaque and the middle and lucent a little bit. So what were you gonna, how would you describe it?
The unilocular cortical.
Corticated.
Corticated.
Yep. What area would you note this in?
I would just say in the ramus of the mandible.
You could, yeah, right side.
So on the quiz, we'll need to say right or left.
Yes, I mean, well, it depends on how you describe it.
That's fine.
If you said, edentulous area number 32, then you wouldn't need to do right, because that would be the right side. So it depends. But if you were just gonna say body of the ramus, you would need to say, I don't know.
And somebody else might come up and mark something.
Yeah, so let's talk about anatomy. Okay, who wants to go first has a pen? You can pass it to someone. Give it to Isabel. I wish Isabel has a pen. Okay, so those of you guys in that very far row. So Emily and Michaela and Brooke, why don't you guys go search? Oh, wait. No, this isn't easy. I gave you a freebie. Okay, where's, Michaela, where is the articular eminence?
Oh, we're doing Pana? Okay.
What's that?
Oh.
Here, the articular eminence right here.
Yeah.
And then the corner. Okay.
Say that, where's the denoid fossa?
Isn't it, so Heidi told me, because I kept missing it, and isn't it the little like pocket, like at the top where the condyle and sits?
Yes,
Okay.
that is the denoid.
Okay.
Articular eminence. Okay, Brooke, where is the, maxillary sinus?
Maxillary sinus would be here, right?
And then where's the zygomatic process? Yes. Everybody agree with that?
Yep.
Emily, where is your maxillary tuberosity?
Oh, it's it.
No, that's the turn.
It's right.
Oh, is this cool?
Yep. Where is your coronoid process?
Is
Right there. Go, do that again. Trace that whole piece.
this whole thing?
Right there. Go back up. Yep. Okay, so what is in between the maxillary tuberosity and the coronoid process? What is also found there? What is also found in that region besides the maxillary tuberosity and the coronoid?
Oh, this is, you're talking about the cherry foot?
Yes, good job. Good job over here. So kind of draw a line where that is found.
You can see it on this side, yeah.
Yeah, you can put it, yeah.
No.
There you go.
Let's see it, yeah.
If you guys miss these on your, I will like literally cry.
You're gonna see this right.
Yeah.
I'm gonna miss the pterygoid process for sure.
So interestingly enough, I'm just gonna point this out to you.
Excuse me.
Yeah, go ahead and pass that to somebody else. This that they circled right here, I've seen that a lot of times on, sometimes with extractions, after extractions, I almost wonder if it's kind like the opposite of like a focal, like maybe it doesn't fill in as much as the sclerotic bone does, and so you almost have like this space which would have been like in between the two roots. And then, so I don't know exactly, but I do see this occasionally. In fact, I thought at first this was my pano, but it's not, but I do have a pano very similar to that. But that would still be something to describe, you know. Okay. Somebody from this row who wants to try to describe this lesion for me? This row here. You guys got saved. Okay, so restorations. Who's going first? Here's number 20. Number 20. Yep. And just write on it. Just write right over the top of it. What is it? next. This is like I'm getting up here. Not quite done yet. Oh, any areas of concern?
This looks like it's like an overhang.
And you said that was an MO, right?
Yeah.
Okay, next person. What did you say?
Occlusal?
Yeah, I think I would go occlusal too.
Okay.
There might be a cusp involved in that, but I think I would say occlusal. That's how I would go. Until I look in the middle. Okay, pass your pens to the people that haven't had a turn yet.
So then on the other one, is that an overhang too? On
Yeah, I
20?
see what you're looking at, that's
Still?
white.
It
Would
could
that
be.
be considered?
Yeah, I mean, if I was catching something right there, I would consider that to be an overhang. This one's definitely an overhang. Actually, I want to go back to this. What is this right? What type of crown is this right here? Sorry, do you know?
Do I know?
Full noble.
What did you say?
Yeah. Well,
She's thinking. Hold
it's
on.
metal, but I can't really.
What are your crown options? So what are the 3 different types of crowns that you could have?
Porcelain fused to metal.
Ceric or all porcelain is one.
Mm-hmm.
Gold
Yes.
or all metal.
Okay.
And then the third one would be a porcelain fused to metal. Now there is a 4th one, a stainless steel, that is very distinctive.
Right, like you can kind of see.
Yeah,
through it,
and
right?
so I don't really include that in it. So based on those 3 choices, porcelain or ceric, which is 1, gold or all metal, which is 1, and a metal, porcelain fused to metal, what type of crown would you say?
Gold.
Okay, and then what type of root canal would you say that is?
Silver points.
Like whether it's like steel
Gutta
points
percha
or gutta
or-
percha.
Yeah,
Steel.
I would say it's gutta
Gutta
percha,
percha.
because it's really bright white when it's the silver point.
So then if, like, there was one on the quiz that was like, I think a ceric to, gutta percha, and it wasn't steel or metal, what is that then? What if, like, where they're all the same, so it wasn't a metal, and it was gutta percha, and so, but like the post and everything too also looked like it was, so is it just ceric?
Or all porcelain, yeah.
Okay.
Yep, and I'll ask for one or the other, just because you need to know both of them, because the true term is all porcelain, but in this area, we always refer to ceric a lot. It's a type of material they use, but we have a tendency to call the crown by the type of material instead of like an all porcelain or all ceramic. Okay. Okay. What type of image is this? Is this a periapical? What is it? A missile. Is this radiolucent or radiolate?
Radiolucent.
What? So both? Yep.
That's not right.
So this one would be like a mixed lucent?
Yes. Yes. That's a good. And the reason why I wouldn't say it's a confluent, a focal, is because it has this radiolucency here. Okay, Ivy and Kaylee, you guys are gonna wish you would have gone already. Okay, can you please label these teeth for me?
Like just number them?
Yes. Great, you guys can work together. Okay, do we agree?
Please.
No. Okay, try again. Maybe step back there and look at it. Step way back there and look at it. Step way back there. Go all the way to the very back of the room and look at it.
Pointy. That's pointy.
Oh my gosh, I don't remember. It's fine.
Just A, B, C, D.
Yeah, now I'm gonna have to see your babies.
But who has them? I see that that one is. I see that that one's a primary. But I can't tell if anyone else has the other ones.
I think this one is
I don't know if any of the top ones are. You think they're baby teeth too?
maybe. I think the middle mixed in.
It's definitely mixed.
The canine might be.
You guys need help?
Well, can we like talk out loud?
Yeah.
And then have people vote? So this one definitely looks like a primary.
Okay.
Along, maybe this one? What's pointing right?
Okay. So what, I just really quick, what makes, that one that definitely looks like primary, what about it makes it look like a primary?
All the roots.
Yeah,
And that
and like, look at how thin that enamel is.
The occlusal surfaces are.
So, primary then, in that location, what type of tooth is that? Molar, canine, what type of teeth do we have?
Molars.
Molars, okay, so how many molars do we have in the primary?
yes.
Okay, so can we label those two?
Too hard to say that.
Do you know what the last primary tooth is? The last one is
So
T.
right, you heard her say that.
T, okay. So which one's T?
Because that's fucking. It says right here in the book, silver points appear high.
So the one next
Opaque
to it
similar
would
to other
be-
metallic objects. Silver points appear more radiopaque than
So
gold.
S,
I think the way that she said it just made it sound
I had to
confusing.
think
because I
about
was
it.
confused too.
Okay, so
And I just
the
figured
tooth
I
is
scrambled
the
it out in my
distal,
brain.
what tooth number is that?
She just mixed them up, I think.
No?
Or what are you asking?
Yep,
You're right,
So-
though.
yep,
The cut up her chair.
So that's gotta be like the first molar, the three molars come in from these.
yep.
So then that's. It's the,
Yep. Okay, Ivy, so what are your two options on the top? Based on the T and S, what are your two options on the top that you would have?
I think we got the same kind of thing going. I think that this is, these two are primary. And this one's permanent.
Okay, so what two numbers would that be?
This one's gonna be 3. And this one's 3, right?
Mm-hmm.
I don't know if the canines are primary or permanent.
Based on what you're seeing here, what do you think they would be? Based on age.
primary, right? Because doesn't the first molar come, the first premolar comes before the canine?
There you go. Yay! Give a round of applause. Okay. Restorations. Who wants to chart restorations in this third row here? Okay, stop. Any concerns about these teeth? When you look at them, do you have any concerns? Can you come up with an explanation as to why they have restorations?
Baby teeth?
Maybe these have been more open like that at one point.
With the fillings, yeah. What else about these teeth looks a little different?
They're still primary, aren't they?
They're still primary. Do you see this? What is this?
Is that too thick?
Is that really thin?
It's really
enamel?
thin enamel.
Right. So what would be an unmet need for this patient?
Sealants? That's not an unmet need.
Functioning tissue.
Yeah, just trying to maybe help them mitigate. Yeah, some sort of solution to help them. Okay, so pass.
Oh, sorry.
You can go again.
So Julie, what were you saying about the backup plan?
We don't, we just found out last week. So at this point, you're just gonna have more clinic, see more patients in clinic. I do have one idea, but it's not like